So I want to welcome everyone to today's meeting concerning the Colorado Prescription Drug Monitoring Program. Today's meeting is hosted by the Division of Professions and Occupations here at the Colorado Department of Regulatory Agencies. My name is Justin Wipf. I am the program analyst for the Colorado PDMP. We also have Dimitri Kunin, who's the Senior Program Director for the Colorado State Board of Pharmacy and the Colorado PDMP, as well as Kathy Traugott, who is our Division's Deputy Director for Programs, and Sarah Werner, who is our Division's Deputy Director for External Affairs. So the purpose of today's meeting is actually twofold. First, we will be discussing several legislative updates concerning the Colorado PDMP that are currently in effect. And the second purpose of this meeting is a training session under the interagency agreement that we have with our sister agency, the Colorado Department of Public Health and Environment. CDPHE supports several aspects of the PDMP, including my position as the program analyst. And under our interagency agreement, we are required to hold training sessions regarding the PDMP. So the presentation portion will last about 20 to 25 minutes. And we ask that if you have any questions during the presentation, you can submit them through the Q&A link, and our team will be answering those questions once we conclude the presentation portion. Please also note that we will be posting a recording of this webinar on our DORA PDMP website, and we'll also be generating a frequently asked questions document that's the result of the frequently asked questions we get throughout this presentation. And that document will also be posted to the DORA PDMP website here in the near future. So with respect to legislative updates, there were two bills that passed in this recent legislative session with respect to the PDMP. Colorado Senate Bill 22027 was the shorter of the two. One of the provisions in that bill clarified that the PDMP registration requirement applies to all DEA licensed practitioners and all pharmacists who are licensed in Colorado. And if you are a DEA licensed practitioner or pharmacist holding a Colorado license, regardless of whether you are currently practicing in Colorado or are currently practicing at all, you are still required to register and maintain a user account with the Colorado PDMP at colorado.pmpaware.net. The other bill was Colorado House Bill 221115. This was the larger of the two bills. It has several provisions in there. We'll be discussing several of those today. The first provision is a removal of restrictions on the number of delegate users that a DEA licensed practitioner or a pharmacist may authorize to query the PDMP on that practitioner's behalf or on that pharmacist's behalf. So previously, Colorado law only allowed a practitioner to have up to 3 delegate users, and a pharmacist was only allowed to have up to 6 delegate users to search the PDMP on behalf of that supervising practitioner or pharmacist. Now, the item that's probably gotten the most attention is relating to the expanded PDMP use or PDMP query requirement. Both of these pieces of legislation addressed the language that had been passed under last year's Colorado House Bill 211276. The legislation from last year had provisions in there that essentially attempted to require practitioners to query the PDMP before prescribing certain opioid and benzodiazepine prescriptions, but there were some discrepancies in the statutory citations on that use requirement. So these two bills clarify that the PDMP query requirement applies to all opioid and benzodiazepine prescriptions, with the exception of those conditions or situations that are exempted in statute. So in brief regarding opioid prescriptions, a practitioner or their delegate user is required to query the PDMP prior to prescribing any opioid, unless that patient receiving the prescription is either receiving the opioid in a hospital, a skilled nursing facility, a residential facility, or a correctional facility, or has been diagnosed with cancer and is experiencing cancer-related pain, or is undergoing palliative care or hospice care, or is experiencing post-surgical pain that because of the nature of the procedure, the pain is expected to last more than 14 days, or a patient who's receiving treatment during a natural disaster or incident where mass casualties have taken place, or if the patient is receiving only a single dose of an opioid to relieve pain for a single test or procedure. Now, regarding the benzodiazepine query requirement, these bills do clarify that a practitioner is required to query the PDMP before prescribing a benzodiazepine to a patient, unless that benzodiazepine is being prescribed to a patient in hospice, or if it is being prescribed to treat epilepsy, a seizure disorder, suspected seizure disorder, spasticity, alcohol withdrawal, or a neurological condition, including a post-traumatic brain injury or catatonia. Now, folks have been probably wondering exactly how this will be enforced. So I do want to point out a couple of statutory references with respect to this PDMP query requirement. So the language around the PDMP query requirement and restrictions around certain opioids and benzodiazepines in terms of days supply can be found in both Title 12, Article 30, which is the provisions that are applicable to healthcare professions and occupations, as well as Part 4 of Title 12, Article 280, which is the Pharmacist, Pharmacy Business, and Pharmaceuticals Practice Act. So under 12-30-109-1B, which is under the Article 30, that statutory citation states that the failure to comply with this requirement is grounds for unprofessional conduct if the practitioner repeatedly fails to comply. And then under the Pharmacy Practice Act, it states that a violation of this requirement does not create a private right of action or serve as the basis of a cause of action. Should also be noted that Colorado law under the PDMP authority, the PDMP does not have the statutory authority to notify licensing boards of a practitioner's compliance with their PDMP utilization requirement on an unsolicited or a proactive basis. However, a licensing board can subpoena a practitioner's PDMP information if the board receives a complaint against that practitioner. So essentially under 12-280-4043I of Colorado Revised Statutes, the Colorado PDMP is available for query to state regulatory boards within the Division of Professions and Occupations and the division director, so long as the information released is specific to an individual practitioner and is part of a bona fide investigation, and the request for information is accompanied by an official court order or subpoena. So in brief, the PDMP cannot generate a complaint or send notices on a proactive basis to practitioners' licensing boards about anything related to their PDMP activity, including this PDMP use requirement, but the boards could certainly subpoena and review that information if they open an investigation into a practitioner. So those are the primary statutory updates that are currently in effect that we wanted to discuss today. There are a couple that are not yet in effect, which we will be following up as more information becomes available, namely the PDMP integration funding. That is something that we are currently researching our options, and we'll absolutely be notifying practitioners, pharmacists, PDMP users, and other stakeholders when we have more information on that topic. So as we transition to the training focused portion of this presentation, Want to note that we actually, back in 2020, under our interagency agreement with CDPHE, have already created several tutorial documents and have webinar recordings that are available on the DORA PDMP training page. Those documents include how to create a PDMP account for a prescriber, the key PDMP aware web portal features and functions for prescribers, and also ones on the creation of a delegate PDMP aware account and the key features and functions that are available for delegate users, as well as the patient alerts and prescriber reports, which are two different kinds of unsolicited reports sent by the PDMP. We also have a brief one on how to do a bulk patient search through the PDMP aware web portal. So that item essentially allows a practitioner or their delegate user to query multiple patients all at one time. And I do want to briefly point out the DORA PDMP website here. So if you go to the DORA PDMP webpage, which is dpo.colorado.gov/PDMP, there is a link to the PDMP Aware web portal here for either logging into your existing account or creating a new account. And then this link for the PDMP tutorials, user guides, and webinars is where you can find those 6 tutorial documents. These are all pretty short PDF documents that give you a quick rundown of the step-by-step process for registering and the key functions and features. There are also 4 webinars that have been posted here. The webinars are each about 30 minutes in total. They are generally 15 to 20 minutes of a presentation and then a Q&A session. And this is where a recording of this presentation will be posted, as well as a FAQ document. And I believe the slides from this presentation will likely also get posted there. So to return to our presentation, I want to also discuss delegate access. So with the expanded PDMP utilization requirement and the removal of restriction on delegate users, delegate access is something that practitioners may want to leverage to help save time for themselves in querying the PDMP while ensuring compliance with these expanded use requirements. I do want to note that about half of Colorado practitioners already have a connection to the PDMP through their EHR or their electronic prescribing software. And all of the major pharmacy chains and some of the independent pharmacies also have an integrated connection to the PDMP within their pharmacy management systems. And if you have that integrated access, you can query the Colorado PDMP for a patient either directly through their chart within the EHR or in the electronic prescribing workflow, or for a pharmacist while they are filling or in the dispensation process for a prescription. However, the delegates are not able to access the PDMP through those integrated connections. So delegates can only use the PDMP Aware web portal to search the PDMP. And if you are a practitioner who does not already have that integrated access, you would have to search the PDMP through the PDMP Aware web portal as well. So to save time for you as a practitioner, the delegate access is one way to assist with your ability to access this information. There are several important things to note regarding the supervisor's responsibilities for delegate access. So one, supervisors are responsible for ensuring that delegate access is limited to what is authorized under Colorado law for a practitioner or a pharmacist, and that the access occurs in a manner that protects the confidentiality of the PDMP information. So in brief, a practitioner can query the PDMP for any current patient, and then a pharmacist can access PDMP information for any patient to whom that pharmacist is dispensing or considering dispensing a prescription drug to, or a patient to whom that pharmacist is currently providing clinical patient services. Now, the Supervisor is also responsible for any negligent breach of confidentiality of information obtained by their delegate user. And the supervising practitioner or supervising pharmacist is also subject to penalties for inappropriate access of PDMP information by that delegate user. And in brief, the penalties for inappropriate access would be a civil fine of no less than $1,000 and no more than $10,000 for each violation. Now in Colorado, there are no license-based requirements for who can be a delegate. So you do not need to hold any particular professional license with the division in order to be a delegate user for a supervising practitioner or pharmacist. However, the delegate user does need to be employed by or under contract with the same professional practice as the supervising practitioner or the same pharmacy as the supervising pharmacist. Additionally, the supervising practitioner or pharmacist is required to take reasonable steps to ensure that the delegate is sufficiently competent in the use of the PDMP. So that is one area where our tutorial documents around delegate registration and use of the PDMP may come in handy. And also want to note that the law does require delegate users to register their own user account. It's going to either be the prescriber delegate unlicensed or the pharmacist delegate unlicensed role. And the delegate user will need to list their own information in their registration. And then at the end of that registration, they need to link their account to their supervisor by entering their supervisor's PDMP login email address. It should also be noted that a delegate can be a delegate for multiple supervising practitioners or pharmacists. So again, the delegate user needs to have their own account. They should not be logging in with their supervisor's account. There are different permissions available for a practitioner or their delegate user. So it is important that delegates are using their own user account. When completing the registration process, again, there's a section in the registration to enter your supervisor's email. One note is before you begin that registration process, I would highly recommend that you make sure you have your supervisor's PDMP login email before you start that registration process. Your supervisor might have the account under a personal email address or a work email. And if you don't list the email that belongs to that supervisor, you're not going to be able to complete that application. Additionally, if you have multiple supervisors, it'll be important when you're searching the PDMP. Essentially, you'll be prompted to select your supervisor before you run a patient search. And it'll be important they select the appropriate supervisor because that delegate search would be credited to the supervising practitioner that they select. And with respect to the PDMP query requirements before prescribing certain opioids and benzodiazepines, the supervisor who's prescribing that medication needs to be selected in order to be credited for that delegate search. And again, delegate users can have multiple supervisors. Supervisors can have multiple delegates. And it should also be noted that the supervisor will need to approve any delegate user in the delegate management menu of their PDMP account. You will receive, as a supervisor, once a delegate user submits a request to be your delegate, you'll receive an automated email from our system advising that there is a delegate pending your review in your PDMP account. There is also the option for a supervisor to add delegates who are already listed as a delegate user in the PMP Aware web portal through their own delegate management menu. So if someone at your office is currently set up as a delegate for someone else at your office and you want to add them as your delegate as well, there's an add button in your delegate management menu. You just need to put that delegate user's PDMP login email address as your delegate and they will be approved. It should be noted that only works if that person already has a user account. Finally, I want to note that supervisors are required to re-verify their delegates each year. So the delegate re-verification period opens in February. There's a 30-day period in which the supervisor can go in and verify that all of the delegates currently listed on their account are still approved to access the PDMP on their behalf. If the supervisor does not go through that process during that 30-day window, all of the delegates would be kicked back to a pending status until that supervisor goes in and re-verifies the users. It's just a couple items for repeat notice and some additional tips here. DORA's PDMP website is at dpo.colorado.gov/PDMP. You can find a link to the PMP Aware web portal through there. You can also go directly to the PMP Aware web portal at colorado.pmpaware.net. The training resources are also available on that DORA PDMP website. And again, recent legislation confirmed that it does not matter if you're currently practicing in Colorado, if you are a DEA licensed practitioner or a pharmacist holding a Colorado license, you are required to have an account with the Colorado PDMP. Again, that delegate re-verification process occurs in February of each year, and you will receive an email in February if you have delegate users linked to your account that require re-verification. Then one final brief tip, you do have the ability to add a mobile phone number to your Colorado PDMP account for password reset purposes through your My Profile menu. Having that mobile phone number on file can be very useful, especially if you are using a work email that you may potentially lose access to if you ever change employers. So if a mobile phone number is on file and the login email address is no longer accessible, you can reset your password by receiving a verification code via text message. And then once you're logged into your account, you can update your login email address also in that My Profile menu. So that can really come in handy. If you aren't able to reset your password yourself, you'd actually have to contact us as the state administrators for assistance. So as far as contact information goes, our vendor does have 24/7 support available at 855-263-6403. So that is Bamboo Health, our vendor. They were previously known as APRIS, but they provide that 24/7 support, and they can help with just general assistance. If you're unsure if you are currently registered with the PDMP, they can confirm your registration status. They can also confirm your current login email address or provide general troubleshooting. But again, they can't change your login email address or any other information on your account. That's something that we as the state administrators will need to do. And then I do also want to note that any automated notification that's coming from the PDMP regarding your account is going to come from the email address no-reply@colorado.pmpaware.net. So those automated notifications include a verification email when you first register, confirmation when your account's been approved, notification if you have any delegates pending approval. There's automated notifications if you receive a patient alert, or will be notified when your prescriber report or scorecard is available to be viewed in your PDMP account. And then you'll also receive automated notifications when your password is nearing expiration. Your password is valid for 1 year. I know you get a notification when you are 14 days from your password expiring, and then there are several others leading up to that expiration date if you don't log in and update your password. Now, if you need to contact us as the state administrators, you can either call us between 8 a.m. and 5 p.m. Monday through Friday at 303-894-5957, or you can contact us via email at pdmpinq@state.co.us. So we can help with updating your PDMP account if your login email address is not accessible. We can also change any other information if you need, adding additional DEA numbers, changing your phone number, things like that. And then we can also answer any other general questions or support needs regarding the Colorado PDMP. And I'll leave this contact slide up for just a moment, but that concludes the presentation. So at this point, we are ready for questions. I believe those have been getting submitted through the Q&A, and going to hand it off to our other participants here to assist with that process.
Thank you, Justin. We have received a number of questions through the Q&A, and others are more than welcome to add questions if they'd like. We'll try to get to as many as we can. Let me start with the first one, Justin. This one is probably best explained by you. So this is asked by one of our participants. Crystal Davis asked, do I need to be a delegate for all of my providers in clinic, or can I just be a delegate under one?
So the important things to note as a delegate user, you, when you are searching the PDMP, are only authorized to do so for a current patient of the practitioner that you are selecting as your supervisor when you run that search. So it is very important, not only as far as what is allowed for with access, but also for generating the search history for that practitioner. As far as this mandated use requirement goes, it's important that you are selecting the appropriate practitioner who is actually prescribing that medication for them to be credited with having that search be performed. So, the intent here is, yes, if you're going to be doing this for multiple practitioners, you need each practitioner to be a supervisor, and you will be prompted before you can run a search to select which supervisor you are running that search on behalf of.
Thank you, Justin. Justin, I think in the same light of delegate users, there's a question that came in. How do we assure that our delegate is being appropriate with the information they are accessing?
Yes, so a supervisor has access to every search that they've performed, as well as every search that their delegate has performed on their own behalf. So if you as a supervisor log into your PMP Aware account, you should see a request history listed directly on your dashboard. You can also go into the menu link and go into request history, and you will see every search that either you or any of your delegates have performed. So that is where your oversight responsibilities can be fulfilled.
Thank you, Justin. Another question came in, and we have a few of these, so they may touch in different ways regarding veterinary practice. So can you address how this will work in veterinary medicine? Obviously, we'll not search Fluffy Smith, in quotes. Will we need to require pet owners to give us personal info and search for their info as well? So
great question. With respect to veterinarians searching the PDMP, a couple very important things to note. One is that you are authorized as a veterinarian, as a practitioner, to query the PDMP for a current patient. However, you are not authorized to query the PDMP for any client. You are allowed to query the PDMP for a client if, in exercise of your professional judgment, you suspect that that client has committed drug abuse or has mistreated an animal, essentially is trying to obtain controlled prescription medication for their, ostensibly for their patient, but for themselves. So only under that scenario can you query a client. Now, with respect to searching for a patient, an animal patient in the PDMP, it's important to note that any dispensation that occurred from a veterinarian's office does not need to be reported to the PDMP. So only a controlled substance that's dispensed to an animal patient from a pharmacy will be recorded in the PDMP. Also, very important to note, as a veterinarian or as a user, there is a way to get around the date of birth requirement when you're searching the PDMP. And when you're searching for an animal patient, it is going to be the pet's name as the first name, the owner's name is the last name. And if you select on the name search, there's a partial name box right below the first name, right below the last name. If you select that, you are not required to put in a date of birth. So you can run that search with just the animal's name, and you will receive essentially a list of names and the corresponding addresses that match that criteria. And based off of that, you could hopefully find your animal patient and view that animal's prescription history without having to deal with getting you're guessing a date of birth or getting a client's date of birth or attempting to search that client's information.
Thank you, Justin. Yeah, I think that took care of a number of questions that came in. If there's a different veterinary one that we come across, I'll let you know. Here's a question that comes up every now and then from users or users that used to have an account. We have one that asks, if you have had a PDMP account in the past, do you need to set up a new account?
So, couple caveats there, but generally speaking, if your PDMP account has been set up since August of 2017, so within the last 5 years, your profile is complete. If you had registered with the PDMP before August 2017, you would have at some point over the last 5 years needed to have logged in and completed your profile. That was because of a vendor transition in August 2017. So assuming your profile is complete, as long as your Colorado professional license is active and as long as your DEA license, if you're a practitioner, is active, the PDMP account will remain active. We verify on a daily basis that your that your DEA license and that your Colorado professional license are in active status. If they go into some kind of non-active status, the PDMP account does get turned off at that point. We do try to review and reactivate accounts that have been deactivated in the past. If for some reason, say your license went non-active for an extended period of time. However, there are a number of folks who last year, we did have to purge a number of incomplete accounts from the system. If you were one of those individuals, we would have sent you an email in September of 2021 advising that your account was incomplete and you needed to either register a new account or complete that incomplete profile. If you didn't take action after that notice, we also sent a notice in October of 2021 to every practitioner to the email address listed on their professional license of their non-registration with the PDMP as required by law. So you hopefully should have received notifications from us at some point in the past on your account status if there's an issue. But again, if you just wanted to check with our vendor to confirm that your account is active and that you do have one, you can call this 855-263-6403 number anytime, 24/7, and they can give you a confirmation that, yes, you are registered. Here's the email address that the account's under. Again, they can't change any information on your account, but if you end up needing to update your email and can't get into your account, at that point, you can contact us and we can assist with that.
Thanks, Justin. And just a reminder to everyone, these slides will be posted. So if you feel like you need to double check the email address or the phone numbers here, you'll have access to that if you can't write them down now. And Justin, this next question, and actually let me say too, I think for the most part, Justin, if somebody calls that number to the PDMP on the previous slide, the wait time is pretty low, right? It's not like they're on hold. I imagine maybe after this training, it may bump a little bit, but in general, they answer and take care of individuals pretty quickly, correct?
Yeah, I've had to call their support a few times, either in the conference call with a user or just called with a general check-in on, say, a weird system issue or something like that. And I've never had to wait more than a couple minutes. They've been pretty quick. It's a sort of a national user support phone center that they have. They are the vendor for about 40 other states. So yeah, they do have a pretty good phone support system that covers all of their client states. And yeah, generally speaking, they're pretty quick.
Thank you. Right, here's a question. Are we considering buprenorphine an opioid in the context of mandatory checking in the PDMP?
So that's a great question. And technically speaking, an opioid or a buprenorphine is an opioid. And the Colorado statute doesn't have any exemption for buprenorphine prescription or for medication-assisted treatment.
Thank you, Justin. And then going back gear that we were just in, another quick question that came in, the registration site does not accept my DEA number. What should I do to correct this?
So if you're attempting to register and you're being told that your DEA is already in use, that would mean that you already have a user account. It won't allow you to create multiple accounts under the same DEA number. That'll be a sign that you'll need to contact. You can contact the vendor support to figure out what email the account's under, or you'll need to contact us to change your login email address. However, there's a second scenario. If you're going through the registration process, there is an add button right next to the DEA number that will actually load that to the application. And if you don't hit that add button, it's not actually listed on your application, and you'll be told that your DEA number is invalid. So in that scenario, all you need to do is make sure you're clicking that add button to have it loaded to the account. And once you click that add button, if you're already registered, at that point, you will be blocked with a message saying that that DEA number is already in use. So hopefully that covers either one of the scenarios that you're experiencing.
Thank you, Justin. We've had at least 2 or 3 questions come in this regard. Could we discuss the implications for the VA and our DoD affiliated bases in Colorado?
Well, you know, with respect to those practitioners who are licensed in Colorado that are working for the VA, they're subject to the same, license-based requirements around PDMP as anyone else. It's a great question as far as those who are practicing in Colorado with the VA who hold a professional license in another state. Again, the PDMP use requirement is something that licensing boards would only be able to, subpoena from the PDMP if they were to open an investigation into one of our licensees. So if that practitioner is not a licensee here in Colorado, our licensing board would, be limited in what they could do with respect to that individual. I can't speak for what another state would do if they were to receive a complaint about a practitioner working for the VA here in Colorado who's actually licensed in whatever state they're licensed in.
Thank you, Justin. We've had a few questions come in regarding refills and just when, again, prescribers or dispensers are supposed to check. It may be useful to go back to those slides where you discussed that. Now, specifically, I'll read one of the questions. Do we have to check on every, quote, refill of a narcotic or just the initial prescription? This is an area of confusion.
Dimitri, you might be in a better position to kind of discuss the differences and make sure people are aware what we're talking about when we say a refill or say a new prescription for a patient who's previously had a prescription. So, I know with the Schedule 4 medications like benzodiazepines or tramadol, when you're writing a prescription, you can include refills for that prescription. And those refills under that original prescription that you've written is not you're not writing new prescriptions each time. Those refills are under that original prescription, and the PDMP query requirement requires that you check before you write the prescription. Now, for the other scenario where sometimes people use the word refill, but it's not technically a refill, perhaps, Dimitri, you can go into that in a little more detail.
Yeah, sure, Justin, I'd be happy to. And I think that's just it, right? There's a lot of nuance to the terminology itself. And because it can be used in different ways in different contexts, I don't want to create any further confusion by blanketing an answer, right? That will somehow apply to all circumstances. But ultimately, from the dispenser side or the pharmacy side, prior to the dispensation of a prescription for a controlled substance, the PDMP should be checked. And beyond what's written in terms of requirements for queries within statute, please understand we are not able to provide practice opinion or interpretation of the law in that regard. But ultimately, like Justin described, there is some difference in the context of a refill, both from a prescriber and how a refill is understood and administered in a pharmacy. And then let me find. So I think one individual is asking this question, and it may be in the minds of others that don't work with legislation every session or don't see changes, but their ask is, when does this ruling go into effect?
Well, Senate Bill 22-027 took effect immediately, and House Bill 22-1115 took effect on August 10th. Both bills had the PDMP query requirement in there, so they are both currently in effect and technically took effect with the sign date of Senate Bill 22-027, which was in May.
Moving on to another question. Somebody asks, I assume PDMP also applies to stimulants, which are controlled substances. And I think this is a great point of clarity and reminder, as often the conversation is around, opioids as a term, or benzodiazepines, especially in the last few years. But the PDMP houses and collects all controlled substance information from dispensations. Justin, if you want to add anything to that, you're more than welcome to.
Yeah, I mean, we receive every Schedule 2 through Schedule 5 controlled substance that is dispensed by a prescription drug outlet to a Colorado patient, which includes both your retail pharmacies here in the state, as well as mail order pharmacies that may be shipping medication across state lines. If those prescriptions are dispensed to a Colorado patient, they need to be reported here to the PDMP. So we do collect information on stimulants, and that is a metric that if you are a prescriber that prescribes stimulants, your quarterly prescriber report or scorecard does summarize your prescribing activity for opioids, stimulants, sedatives, and there's a separate category for buprenorphine in the prescriber report that also summarizes potentially high-risk prescribing and summarizes your utilization activity. And for the last 4 quarterly reports that have gone out, you can, through your PMPware account, drill down into more detail and see, the underlying patients and prescriptions that are making up the data summarized on your prescriber report. But in brief, yes, we do collect the stimulant prescription, but there is not a PDMP statutory requirement to query the PDMP before prescribing a stimulant. Now, it's obviously best practice to query the PDMP before you're writing any controlled prescription, and you are authorized to query the PDMP for any current patient. There's no restrictions around only being able to query it, for a patient when you're considering prescribing a certain medication that's available for any current patient.
Thank you, Justin. This next question goes back to the topic of VAs. Can you clarify if the VA meds show up in the Colorado PDMP if the prescriber is registered to prescribe in Colorado?
So it's irrespective of who the prescriber is. The VA pharmacies report their dispensations. The VA pharmacies located here in Colorado do report those dispensations here to the Colorado PDMP. There's a couple minor caveats that I want to note about the VA. So if you are a VA patient being serviced by the Cheyenne VA in Wyoming, the last I have heard was that, and this is still correct, I am almost 100% sure, the Cheyenne VA, if they are dispensing from there, would be reporting that to the Wyoming PDMP. They also have a mail order pharmacy in Tennessee that does the large majority of the VA's mail order prescriptions. And from what we've seen, it appears that those are also only being reported to the state in which that VA pharmacy is located in. That is something that a lot of state PDMPs have, contacted or inquired with the VA about reporting that to the location where the patient actually resides, but we haven't seen any change there. So if it was a VA facility here, it doesn't matter if that prescriber is registered with the PDMP account or with a PDMP account or not. That pharmacy located here will be reporting that dispensation to our PDMP. The active duty military health system, which is sometimes known as TRICARE, they operate their own PDMP and they report the dispensations under that active duty military TRICARE system to what's called the military health system PDMP. So that's not reported here to the Colorado PDMP. However, we do have a data sharing agreement in place with the military health system. And so if you are a user and you are performing a patient search, when you are on that page, you'll see a list of states that you can also search, and the military health system will be one of those options. And again, yeah, if you're a practitioner treating any VA patients outside of the VA system, if they're in northern Colorado, you may want to also query the Wyoming PDMP. And if they're receiving mail order prescriptions, my understanding is Tennessee is where the vast majority of those are being shipped from.
Thank you, Justin. So we're going to go back into the veterinary buckets since there's a few more questions that have come in about that. This one that I'll ask, I think, will cover a lot of it. Could the presenters please give more detail for veterinarians on any special requirements as the patients, in quote, cannot be looked up and we do not typically have access to our clients' birthdays to look them up in the system? I think you've answered it in some part in the past, but if you could just speak to that, because I think it's of interest both to pharmacies and to individuals in that practice area.
Yeah, so again, the way around the date of birth requirements when searching the PDMP for an animal patient is there's a partial name box that you can check. It is right below the pass or the user name field. And I suppose, why don't I show real briefly? Quick demonstration here. If you go into the patient request menu, this partial spelling box removes the date of birth requirements and requires only the minimum of the first 3 characters for a first and a last name. So if you select this partial spelling, you do not need a date of birth. And then you can use the patient's name as the first name, owner's name as the last name. And when you run the search, it will bring up a list of patients who meet that first and last name that you entered. Hopefully that's a pretty short list. It will include an address on there. So you should be able to, based on that information, assuming the patient has a prescription in the PDMP, be able to find that animal patient and review their prescription history there.
Thank you, Justin.
I think while I have this open, I just want to show the delegate management menu very briefly. So if you are a practitioner, you can go into this delegate management menu. It's also, actually, sorry, it's easiest to find it right over here. So you'll see if there's a delegate that's pending your approval, they will show up here, and here's where you can reject or approve that delegate. And then if there's someone else who is not already a delegate but has a PDMP account, you can enter that email, and assuming that matches, you can add that delegate user without needing them to submit a request to you for access.
Thank you, Justin. I think this question is one that comes up every now and then, and I've seen, would a pharmacist or a prescriber working in a managed care or insurance setting, or potentially other settings, be able to query patients enrolled in their plan without penalty? Ultimately, I think the question is getting who can a prescriber or dispenser query, and when, in terms of appropriateness based on statute?
So a DEA licensed practitioner can only query the PDMP for a current patient of that practitioner. And a pharmacist can only query the PDMP for a patient to whom that pharmacist is dispensing or considering dispensing a prescription drug to, or to whom that pharmacist is currently providing clinical patient services. Dimitri, I don't know if you have anything else you'd like to add, or Kathy, if you'd like to add anything else on that.
The only thing I'll add, and this is a question that came in as well, we often use the term query like its regular verbiage here. Just a reminder to everyone that the word query is synonymous with looking up a patient in the PDMP or searching the patient in the PDMP. I know that's not always a common term for all, so I think somebody had asked, can you re-explain what the query part means and how do we do that once we're registered? So hopefully that clarified the terminology.
Yes, and again, so the query, that word is used throughout statute, which is kind of why we tend to use that word frequently, but the patient request, to get under that menu of RX search, patient request is where you can put in the patient's information. Generally speaking, like I said, unless you do the partial spelling, first name, last name, and date of birth is all that's required there. The search has a default of the past year, but you can make changes to that date range. And then further below, this is where all of the states in which we have data sharing agreements with and which have permission for that particular role to search will be listed here. The only caveat there is there are actually two data sharing hubs. The RX Check data sharing hub is going to be the only hub in which you can search Nebraska or Kentucky. Excuse me, Utah is available through both hubs. So don't necessarily need to select RX Check for Utah. And then there is also an option if you go into your default PMPI states through your link there, you can select some states to search each time you run the search so that you don't need to select that state every time. I will tell you, if you were to select all of the states on this list, that will slow things down somewhat. So usually people will do default states limited to, say, a neighboring state, especially say if you're near the border of New Mexico. Always searching both Colorado and New Mexico can, be very handy to make sure that you're catching any of your patients who might be going to a pharmacy on the, across state lines, and perhaps that pharmacy is not reporting it over here to the Colorado PDMP.
Thank you, Justin. And there's one more question we can kind of tackle in the same regard. I know I mentioned kind of the terminology regarding queries and searches and looking up a patient. Somebody also asked, so currently there are no rules that the pharmacy must run a report, either a one-time or periodic. So we've touched on the query requirement, but I think oftentimes when we speak about delegates and running a patient report, that's also synonymous with a query or a search of a patient. Is that correct?
That would be my understanding of that question, yes. And it is correct that there are no statutory requirements around a pharmacist checking the PDMP before they dispense a prescription. However, absolutely would be best practice.
Okay. So it's 5 till. I just want to let the participants and attendees know we're doing our best to answer all the questions we can. A lot have come in. We won't be able to cover all of them in the next 5 minutes. We will squeeze a few more in, but sometime in the coming, I'd say 2 to 3 weeks, we're hoping to get a Q&A put together for questions that came through this webinar, as well as others that may have the same presentation. And hopefully we'll have that on our website soon for you to reference if you need to. There is a great question that came in, kind of speaking in line. Is scheduled. If a patient is scheduled to be seen, is it okay to check the PDMP prior to their visit?
If that patient has engaged in agreement to be a patient of that practitioner, yes. So if it is a prospective patient, one that someone has not taken on as a patient yet, you cannot query the PDMP before that agreement is in place before they are a current patient. Outside of that, there's no restriction on when you can search the PDMP for a current patient.
Thank you, Justin. I'm just looking for a good question to toss your way. So let me ask this. You may want to answer it in a different way based on how it's phrased, but you mentioned that a query give the prescriber, quote, credit in the database. Does that mean you are linking or counting the number of queries and the number of prescriptions, or is it more complex? I believe what this individual is essentially asking is, how is a check by a practitioner or a user of the system aligned with the actual prescription?
Well, there are ways of essentially, with reporting tools that we use internally, matching, okay, did you query the PDMP before this prescription for this patient? So there are ways of linking the search history and your prescription history to match that up. But, in brief, if a practitioner's PDMP records are going to were to be subpoenaed by their licensing board, they could subpoena both your search history and your prescription history. Now, when those search results are generated, this is same thing we can see as what you as the user can see. When you go into your own request history on your PDMP account, you'll see every search that you performed. You'll also see the searches the delegate performed, and it will say searched by this delegate user on behalf of you as the supervisor. So that's how it gets recorded, and it does record the patient's name and date of birth when you're generating a search. So yeah, we have ways of comparing your prescribing and your search activity. Obviously, there's some caveats. It says it's a violation if you repeatedly fail to comply. So that particular question would be for the licensing board in determining, how exactly to handle an investigation that leverages PDMP information.
Thank you, Justin. This question that I'll ask came in some different ways, so I'll try and paraphrase it. Ultimately, these new requirements came out of the legislative session this year prior, and the way you can look up the bills and the changes are available now for individuals if they want to read the actual law, which we encourage everyone to do so, specifically in their Practice Act. The actual statute that's posted on the PDMP website or the Board of Pharmacy page, that's part of the Pharmacy Practice Act, that doesn't get updated until just a few weeks from now. We anticipate a final version of the statute, so it's all in one place. So I wanted to ensure individuals weren't confused by looking at one or the other. And Justin, I don't think they were necessarily referenced or linked in your slides, and if they were, correct me, but we can also provide that in the Q&A, a link to the current statutes that came out of session, should individual want to read that before it's finalized elsewhere.
So I know the first email invitation that we sent out on August 3rd mentioned these two pieces of legislation, and I'm almost positive we had a link to the bills there. We did also, in that invitation from August 3rd, include a mention of the PDMP task force annual report. We had some slides on that we were going to hope to touch on very briefly if we have time, but don't know that we will. But in brief, the PDMP task force was given an additional requirement in this year's legislation to evaluate balancing the needs of the program as a healthcare tool with the enforcement requirements under PDMP statute. So that related to law enforcement access to PDMP data, which in Colorado requires a subpoena or court order and must be associated with an active investigation against an individual practitioner, pharmacy, or patient. And then for licensing boards, that is restricted to subpoena in connection with an active investigation against a licensee. So the task force did sort of tackle those questions The report is available on the Colorado Legislature's website, and I would highly recommend, if you're looking for more information, to find that email that we sent on August 3rd, because that should have links to the applicable bills and to that annual report if you're interested in reading that.
Thank you, Justin. I want to just take a moment. I know we're just a minute over. Thank everyone for attending. We'll have more information about potential future trainings out soon. Go ahead, Justin.
I was going to say, so under our interagency agreement, if anybody here is attending and is affiliated with any of the professional organizations that, you know, are associated with any of our practitioners or pharmacy or pharmacists, hospital associations, anything like that, we are under our interagency agreement with CDPHE going to be looking for opportunities to get out and either have a booth or host a brief presentation at professional conferences. So if you are interested and represent those organizations and would be interested in having us, please feel free to give us a call or send us an email and we can look into what we might be able to do.
Thank you, Justin. Thank you, everyone, for attending and taking a moment of your time.
Yes, and I think we're gonna potentially need to do another one of these trainings because we were capped at 500 individuals to attend, and I think we had some people shut out. So we will have a recording, but I think we'll be hosting another event. So if anyone you know attempted to get into this meeting and was not able to, we will have more information soon on that.
Thank you all.